Health Cabinet Secretary Sicily for the second time in a week appeared before Senate Ad Hoc Committee probing the controversial multi-billion leased medical equipment scheme. Under the Medical Equipment Services MES program, the Ministry of Health had contracted firms to supply specialized medical kits to the counties for treatment of diseases such as cancer and diabetes. The senators sought clarification as to why the kits were laying dormant in various hospitals and other ports for the past 3 years.
How do you deliver equipment to a facility that does not have even a basic nurse to give it support service?
Utility, the national government has come forward. HR, we are not in a position to take people on payroll, chairperson. I really think I need to be protected so that I don't look like I'm evading. I'm trying the best I possibly can to answer.
The infuriated committee members had pressed the minister to explain why contractors were still on the payroll, yet the project had stalled.
They are being paid. And they are being paid because if I was to take again the case of Meru, and I will tie that to the question why we delivered equipment when there was no room. But the report that I've been given is that indeed there was room because a hospital existed. Meru Level 5 existed. But the designated area where the ICU and radiology was to be placed between when the assessment was done and when the equipment were delivered, the governor had made a decision and put that space to other uses.
At the same time, accusations of a bloated budget on items least dominated the session. Senators sought to find out, among others, why 3 theatre spotlights whose market price is only 5,700 shillings cost 4.3 million shillings in the MES scheme. 2 operating theatre lamps going for 240,000 shillings in the market cost at 9 million shillings, while syringe pumps that would have cost 540,000 shillings only in the direct purchase now cost 17 million shillings in the leased program for 7 years.
Leasing a drip stand for 1.8 million and buying it in the market at 18,000, that is value for money. What is your conscience?
And ministers, you come to answer, you will also tell this committee the rationale of leasing a drip stand, a torch, a linen trolley, a patient trolley. These are things that are regularly and easily available on the Kenyan market.
If it was an outright purchase of item X, you are buying it, you are owning it, you'll be maintaining it, you have to train your people, you have to know where you fit it. It is different from when you actually now come and say, here is the ICU, you will break down the walls in the facility which has been identified to make the equipment fit. You will train for the 7 years. You will ensure that you maintain on a quarterly basis. A team has to make sure that you maintain. And indeed, should the equipment have a problem technically, you will have to replace.
Treasury allocated 95 million shillings per county in the financial years from 2015 to part of 2018, with the amounts having increased to 200 million shillings in the year 2018-2019.
I reiterate, the counties are not being charged.
Yeah.
I reiterate that, Senator, the Chair, you allow me. I stand by that position. Counties are not being charged.
Health Secretary Sicily had claimed that the weakening of the shilling against the dollar occasioned the rise in allocations, with senators calling for suspension of the program pending an audit into its impact. Counties said that they were not consulted by the ministry on the needs for the medical kits before its rollout, with some having separately purchased a CT scan machine which was to be supplied under the deal. Rose Gakuo, K24 Evening Edition.